Hi, my name is Dr. Hannah Kirsch. I'm an assistant clinical professor of neurocritical care at Stanford University, and I'm very excited to talk about our Curing Coma Campaign CDE project. This talk is going to address our common data elements for disorders of consciousness recommendations from the Working Group on Goals of Care and Family Surrogate Decision Maker Data, for which I was one of two first authors, along with Dr. Matt Jaffa. And I'd like to address all of my co-authors, as well as our senior author, Dr. Susanne Muehlschlegel, and thank them for their hard work on this project. So, as part of background, there is an intensification of research on communication and high quality shared decision making in neurocritical care because we know that a lot of the outcomes of our patients depend on ensuring that a patient's goals, values, and priorities are honored in the decision whether or not to continue aggressive and life sustaining care after severe acute brain injury. However, there have been no prior CDE projects that addressed family or decision maker data and outcomes, especially in this population. So all further images are going to be taken from our paper, which you can find published in Neurocritical Care, and I encourage everybody to review. On the left here, you'll see a flow sheet of our development process and our work groups in this Goals of Care and Surrogate Decision Maker CDE project. As part of this, we divided into 5 subgroup domains: clinical variables, decision-making quality, quality of communication, quality of end-of-life care, and surrogate psychological well-being. We individually worked through the classification of CDEs into core, basic, supplemental, and exploratory data elements, and further divided these as to whether they were useful in the acute, chronic, or both phases of severe acute brain injury. This is just a summary of what you'll find in the paper about the CDEs that we found that were pre-existing, that we proposed, and then the classification of those CDEs. You'll see that the clinical variable subgroup came up with the most pre-existing CDEs of 22, surrogate well-being of 10, and the rest actually had no pre-existing CDEs. Our groups additionally proposed a number of CDEs based on literature review and other research. And what we found was that only for the clinical variable subgroup was there one core CDE identified, and that was the mode of death of the patient, as well as 5 basic. For the rest, there were primarily supplemental and then some exploratory CDEs added. I did not summarize it here, but in the full paper, you can also find how we divided these individual instruments into acute, chronic, or both, as well as review the instruments and the study populations in which they were validated. So what you'll see from this chart and a review of the paper is that there are few pre-existing CDEs that exist specifically addressing these domains of surrogate, family wellness, and outcome. And there are no pre-existing study instruments that are specific to our population. And so we collated CDEs that were well validated in comparable publications, including people who were inpatient, the geriatric population, and so on. So next steps for this include further validation of these instruments, especially the ones deemed basic or supplemental, specifically in the severe acute brain injury population in the acute and the chronic phase. This also raises the question of whether we should be creating new instruments that might include interrogation specifically of the stresses that our family and surrogate decision makers feel, as well as medical issues and caregiving issues that are specific to our patient population. And then, of course, this also raises the issue of what we should be using as instruments to make our research comparable across publications and studies, as well as what we should agree on as basic study instruments that we might create on our own. So in brief, while there's not a lot of pre-existing information, we think that we've proposed a strong group of basic, supplemental, and exploratory CDEs to start us off on our data. I want to thank you for your attention and your interest. And of course, I want to thank all of our co-authors as well on this project. Happy World Coma Day.